Let's talk today about what to do prior to your injections and what to expect after your injections. So this is obviously a question I get a lot. People want to know, what do I need to do to give myself the best outcome and what do I need to do afterwards to also give myself the best outcome. I'm Dr. Danny Clark, Director of Orthobiologics here at the Protea Performance Center. So prior to your injections, there's a few things that are kind of a non-negotiable. Depending on your individual case, we might adjust this a little bit, but the main things is that we don't want patients to be taking powerful anti-inflammatories prior to their procedures. This is for a couple reasons. Is Anti-inflammatories affect platelet quality and platelet activity. And the purpose here is that they're not releasing some of their inflammatory signals. And so that's what helps control inflammation. That's why they're anti-inflammatories partially. And then there's also a blood thinning effect that can happen with some anti-inflammatories like aspirin, again, affecting how platelets behave. And we use those platelets to help stimulate a healing response. And so we want those platelets to be functioning as well as possible prior to your injections. We also don't want our patients drinking alcohol for, I like to say minimum 72 hours, but really the longer we can go before and after without alcohol is going to improve the overall response. Alcohol is essentially a toxin that affects our whole body and can make things function in a way that we don't want them to. It also increases our bleeding risk prior to procedure as well. So that's the other important reason why we make that recommendation. But really, it's about making sure that you're kind of at your healthiest by the time we draw that blood or take that bone marrow. And so that when we do those injections, those cells are functioning as well as they possibly can. So now after your injections, there's a kind of a couple different responses that we see is those first couple days after the injection with something, say like PRP, you'll have about 3 days of increased pain in the areas that we inject them. So this is going to feel a little bit like when you first had the injury, if it was an acute injury, or if it's been kind of a slow build over time, it's going to feel like some of your more bad pain days where pain's increased and it hurts to move around a little bit because there's that initial inflammation as that healing process is started. After the first kind of anywhere from 3 to 7 days, generally people have come back down to their baseline level of pain and function. And so in that first week, we're just kind of taking it easy. We do want some light movement and walking and doing daily life things, but we don't want to stress the joints or the ligaments or tendons too much in that first week as they're a little inflamed and irritated because they can be a little bit more sensitive or susceptible to re-injury. But we do want a little bit of movement to keep the blood flowing and help encourage that healing process. After that, so kind of from week 2 through week 4, things are starting to maybe improve a little bit beyond what your baseline pain is. But in that first month, we don't expect a lot to happen. But what we're going to do here is we're going to slowly increase your physical activity levels to the point that by week kind of 4 to 6, patient dependent and condition dependent here, is that you're going to be back to the level of activity you were prior to the procedure. And then from there, the injection or the PRP or the bone marrow concentrate is in there working and healing over the next 2 to 3 months. And then at month 3 is generally where we see the most benefit or the most kind of pain relief. That's really when the most amount of healing has taken place for PRP. Now for something like bone marrow concentrate where we're using your own adult stem cells from your bone marrow, that first 3 months we'll see a lot of change, but that's not done yet. So what's really cool about bone marrow concentrate is it will continue to improve. We have evidence showing that there's still improvements outwards of 12, maybe even 18 months. And so, when we're at that 3-6 month mark and pain is not exactly where we want it to be, that's okay. We just have to be patient with it, let the body do its thing, continue our physical therapy or exercise to help continue to encourage that healing process. And then at the kind of 12-month mark is when we generally reevaluate and see, okay, where are you at now? Where are you at with your pain? And then make a plan to either do another injection, maybe it's less structures this time, or we just leave it alone because you're happy with the improvements, or we just continue something like physical therapy or exercise. If you have any questions about what that recovery process looks like, you can reach out to the clinic. We can schedule a free 15-minute discovery call, and we can talk through all those steps so you can figure out how you can fit a procedure like this into your current life. But the nice thing is that there really is pretty minimal to no downtime with these.